Assalamu alaikum and welcome to the fourth match of Cardiometabolic Premier League, the Battle of Brains, presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into the Group B matches, and today's match is between Civil Champions and LRH Fighters. As we all know the format of the match, only one top team from each group will move to Super 6 stage, and AIMS Invincibles have moved to Super 6 stage from Group A. Today we are blessed with the kind presence of governing council members of Cardiometabolic Premier League. We have with us Professor 𝐂𝐈𝐕𝐈𝐋 Sahab. He is President of PSIM, Professor of Medicine and also Patron-in-Chief of Cardiometabolic Premier League. Along with him we have with us Professor 𝐂𝐈𝐕𝐈𝐋 Sahab. He is Professor of Medicine, Senior Vice President of PSIM, and he would be the umpire of today's match. And last but not the least, we have with us moderator of today's match. He is Assistant Professor of Electrophysiology, Dr. Qurban Hussain Khan Sahab at RIC Rawalpindi. For further moderation, over to Dr. Qurban Hussain Khan Sahab.
Well, hello, Assalamu alaikum. Welcome everybody to this, the fourth match of the Pakistan Cardiometabolic Premier League. We've already had 3 matches, 3 wonderful contests, and Group A has been decided, as Usman Saab said. The wonderful, wonderful team of AIMS Invincibles proved that they lived up to their name and they totally smashed the opposition, and they are through to the next round of this competition, which at the moment is a knockout format. They scored a wonderful 10 out of 10. They smashed their opposition and they are through to the next round. So congratulations and well done to the AIMS Invincibles team. And we have a wonderful contest here today, the first contest of Group B. And I would like to remind the audience and the participants that this is a knockout game. You go hard or you go home. If you do not get through today, we will not see you again. So do your best. The 2 teams today are from different parts of the country. The first team today is from Lady Reading Hospital, and they are the LRH Fighters, and they will be competing with opposition from the south of the country, Civil Champions from Karachi Civil Hospital. So without further ado, I would like to introduce the 2 teams first, and then we'll go on. So we're looking at Lady Reading Hospital. Welcome to the broadcast. LRH Fighters, captain of the team, could you please introduce yourself and also introduce your team members and your mentor, please?
Thank you for the opportunity. We are representing Lady Reading Hospital, Peshawar. We are LRH Fighters. I'm the team captain, Dr. Zishan Ikhtiyar, Junior Registrar Medical B Unit LRH. To my right is our senior resident, Dr. Mohammed Salman. To my left first is Dr. 𝐂𝐈𝐕𝐈𝐋, and to my left second is Dr. Kalimullah. Our mentor is Dr. Mohammed Bilal Awan, and our coach is Associate Professor Salma Zain. We are here, we have been joined by Professor Dr. Ahmed Kafoor as our mentor here. Thank you.
Wonderful, wonderful. Well, I wish you the very best of luck. Take your time, do your best, and I'm sure you'll do absolutely brilliantly. We're joined in this broadcast by our Patron-in-Chief, Professor Ishaq. Professor Kashif Ali Hashmi has also joined us. Professor Azizur Rahman. We will have umpires who will decide if there's any tight calls. So we move on swiftly from LRH Fighters to our Civil Champions from Karachi. Let's have the champions on.
Professor Javed Akram. I'm Dr. Shafaq.
Professor Javed Akram, who is also our Patron-in-Chief, has also joined the broadcast. Welcome to you, sir. Great to have you on board. Karachi, Civil Champions, let's get the show on the road. Introduce yourself and your team members, please.
Assalamu alaikum. My name is Dr. Yusra. On our right side, we have Dr. Kishore and Krishan.
carry on, please.
On our left, we have Dr. Ariba with us. We are representing a civil hospital, Karachi. Our mentor is Dr. Iftikhar Haider Naqvi, and our coach is Dr. Ifat.
Wonderful. Great to have you on board. Looking forward to your performance. Do your best, and I'm sure you'll do your hospital proud. Right, let's move on to the next segment now. We've introduced the teams, the captains, and the mentors. Let's get down to business. Let's go with the coin toss. So you are in front of the screen, Karachi, and civil champions. I'm going to roll the coin, and I'm going to ask the captain of civil champions to call either heads or tails. So let's roll that coin and then call. Roll the coin.
Tails.
Yeah, you said tails before, and it's tails. So you've won the toss. Many congratulations. Winning the toss doesn't mean you've won the match, but you're in the driver's seat now. So you have the choice of deciding which case you are going to do, and you're going to also decide whether you're going to ask the questions or answer the questions. So let's make your decision up about asking or answering the questions first. Do you want to ask the questions from Lady Redding, or do you want to answer the questions from Lady Redding?
We want to answer the questions.
So you want to put up a strong total on the board. Good. Let's give you the options regarding the cases now. Are you going to choose the first case where you're going to answer questions? Are you going to answer case A, or are you going to answer questions related to case B? Your choice.
A. Case A.
Okay, great. You're on the front foot. So the format, just you need to pin the screen on. You need to pin the screen of the CPL, and you will get the first case. Now the format is such: Lady Redding fighters are going to read out the case. The case is going to be absorbed by Karachi civil champions, and then Lady Redding is going to read out the first scenario, the first question, and will read out the questions and the options. After reading out the options, civil champions will have 60 seconds to answer the question. Once they have given their final response in that 60-second time limit, we will lock in that option and we will see how they've done. If you get the answer correct, you will get 6 runs. You will get 0 for an incorrect answer, or if you fail to answer the question, you will also get 0. If there is an issue regarding time limits, or if there's a question or a query, we have our umpires. Today, Professor Azizur Rahman is the umpire on standby, and we're looking forward to his input as well. So let's get started. Lady Redding Hospital, are you there?
Yes.
You are going to read out the scenario, and I hope that Karachi civil champions can hear you and can see the screen. Can you see the scenario on the screen? Karachi, can you see the answer on the scenario on the screen?
Yes.
You can see it. Okay, Lady Redding, read out case scenario A.
Case scenario A, a 45-year-old female came to the medical OPD after randomly checking her fasting capillary blood sugar at home, which came out to be 180 milligram per deciliter. She denies any osmotic symptoms like polyuria, polydipsia, polyphagia. Her BMI is 25. She is living a healthy life and never visited hospital for any complaint.
Professor Munir Azhar is on board. He's our second umpire. Great to have you on board, Professor Munir. Looking forward to hearing from you with your input later on in the game.
Thank you. Thank you very much. Just I joined. Okay.
Great to have you, sir.
Thank you.
Okay, so Karachi, did you get that scenario? Have you absorbed that scenario? Civil champions?
Yes.
Excellent. Now, let's get on to the nitty-gritty. Let's get the show on the road. Let's have some questions. So, Lady Redding, are you ready to read out the question? Question 1, please. Stop
Question
the
one,
countdown, please. Stop the countdown. Read the question, please.
Question 1. What is your next appropriate step according to the scenario? Option A, mark patient as diabetic and advise diet modification and weight reduction. Option B, diet, exercise and metformin. Option C, repeat capillary blood sugar at home after 2 weeks. Option D, advise venous blood sugar fasting from the laboratory. Option E, advise HbA1c.
Countdown begins. Karachi Civil Hospital champions, you have 60 seconds to answer this question, and you're going to have to lock on a response. So consult, take your time, don't jump in. That's our advice to you. Plenty of time, 40 seconds. Both teams, leave your microphones on, please. 25 seconds. 15 seconds.
Our answer is E, advise HbA1c.
Is that your final answer?
Yes.
Okay, let's lock that option. Lock it. Let's see how they do. Oh no. You faced the first delivery and it ended up being an in-swinging Yorker and it smashed your off stump into 2 pieces. So, unfortunate start, but don't worry, you have plenty more opportunities to score well. So your score is 0 after the first question, but don't worry, you're still in this game and you can still do well. So the answer was D, advise venous blood sugar fasting from the laboratory. So no problem, don't worry Karachi, you're still in the hunt, you're still in this match and you can still do it. But stay confident and keep your chins up. Let's move on to the next question. Lady Redding, please read out the question and the options, please.
Question number 2. Her venous blood sugar fasting came out to be 190 mg per deciliter and 2 hours postprandial blood sugar was 280 mg per deciliter. Her BP is 135/80. What is the best initial regimen for her? Option A, diet and exercise alone. Option B, diet, exercise and metformin. Option C, diet, exercise, metformin and aspirin. Option D, diet, exercise, metformin, aspirin and statins. Option E, diet, exercise, metformin, SGLT2 inhibitors, ACE inhibitor.
Clock has started. 1 minute. Take your time.
Diet and exercise alone.
30 seconds.
280 Our option is B, diet, exercise and metformin.
Is that the answer for all of you? Are you all agreed on this? You've got time. Are you agreed? 10 seconds.
Yes.
Okay, let's lock that option in. Option B, diet, exercise and metformin. Can they do it? Can they reverse their loss? It's a lock and yes! Yes, you've done it. You've done it. You've played the short ball and you have hooked it. It's gone high in the air and over the square leg boundary for 6. So you're on the board now. You're off and running and you've relieved some of that pressure from that early mishap. So the score is 6. 6 for civil champions. Well done. Congratulations. Great. Now let's move on to question number 3, please. LRH, are you ready?
Yes.
Go.
Question number 3. She reports having been prescribed something for high cholesterol earlier that she stopped taking. Which of the following lipid lowering medication is least likely to be associated with hyperglycemia? Option A, rosuvastatin. Option B, atorvastatin. C, parvastatin. B, simvastatin. E, ezetimibe.
The clock is counting down.
Hyperglycemia associated with hyperglycemia. Simha, Parva भी देते हैं, Marna भी देते हैं. इसमें क्या पड़े?
Half the time has elapsed. 27 seconds left.
Our option is A, rosuvastatin.
Option A, is that your final choice? There's still time. 8 seconds. Are you sure?
Yes.
Lock option A, please. Is it right or is it wrong? Let's find out. No, no, no. Oh no, you have gone down the track to a spinning delivery. The delivery was wide, the keeper has fielded it, and you have been stumped out. You are out of this question, but you are not out of the game. You are still in the hunt, but unfortunately, in this scenario, I think the aim of the question was to talk about statin link with hyperglycemia, and ezetimibe is obviously a non-statin drug, so I think that's what the gist was, but maybe our umpires would know better. Let's move on to the next question. Don't lose heart, don't lose hope. You can still fight. Don't give up. Keep your fighting spirit up. You're fighting for the honor of your institute. So I know all of the doctors there are watching you. Don't worry, you can still come back into this game. But be careful and consult each other and glean as much information as you can from each other to put up the best total you can. So the score is 6 after 3 questions. Let's see if we can boost that. Let's move on. Question 4, please.
Question 4. She was advised to have her lipid profile in the fasting state. The result came back as follows. Total cholesterol 280 mg per deciliter, LDL cholesterol 180 mg per deciliter, HDL cholesterol 30 mg per deciliter, and serum triglycerides 250 mg per deciliter. Which of the following additional medication is recommended for her? Option A, aspirin 75 mg once daily. Option B, aspirin 75 mg plus clopidogrel 75 mg once daily. Option C, atorvastatin 20 mg once daily. D, atorvastatin 80 mg once daily. E, atorvastatin 80 mg, aspirin 75 mg, and clopidogrel 75 mg once daily.
The clock has started. A bit of a word salad there, lots of medicines there. Let's see if you can sift through the ones that you need to give. Half the time has elapsed.
C. Our option is C.
Option C, 18 seconds left. Is that the opinion of all of you? Are you all in consensus?
Yes.
10 seconds. Okay, let's lock that option in. Let's hope for the best. Fingers crossed. Yes! Yes, you've done it. You've broken the shackles. The spinner bowled his delivery. You read the spin and you smashed it over long off for 6. Well done, well done. You've relieved the pressure. So 4 questions, 2 6s, 2 ducks. So let's see if we can improve that score even more. You've got 12 on the board. Let's move on to question number 5.
Question number 5. She came to the medical OPD after 6 months with complaints of exertional chest pain associated with palpitation. Cardiac workup was done and a diagnosis of stable angina was made. Her current HbA1c is 6.8%. Which of the following changes in her medication would be most appropriate for her? Option A, continue metformin and atorvastatin, advise her to avoid exertion. Option B, continue metformin, atorvastatin and add isosorbide mononitrate 20 mg BD. Option C, continue metformin, atorvastatin and add isosorbide mononitrate 20 mg BD and bisoprolol 5 mg OD. D, continue metformin and atorvastatin and add amlodipine 10 mg once daily. Option E, continue metformin and atorvastatin and refer her for upper GI endoscopy.
Clock is rolling.
Our option is B.
B, is that B for beta?
Yes, option B.
Okay, we've got a bit of time. You're very sure about this. Very aggressive, very confident. Are you absolutely sure? Is that your final decision? There's a lot riding on this. 20 seconds.
B.
Okay, let's lock that in. They're sure. They're absolutely sure. Let's go for it. Lock in B, please. Oh, no. Oh, no. So the answer was C. Continue metformin, atorvastatin, and add isosorbide mononitrate, BD, and bisoprolol 5 mg once a day. So that was the correct answer. Karachi civil champions are under real pressure here. Let's see if they can break the shackles once again. The score is 12 with half the questions left. We can still put up a competitive score, Karachi, but you need to be extremely careful. You need to be extremely careful. So, without further ado, let's move on to question number 6.
Question number 6. She came to the medical OPD after 6 months with complete relief of her chest pain, but complains of dyspnea on exertion. X-ray chest showed mild cardiomegaly. Echocardiography was done that showed diffuse hypokinesia and ejection fraction of 40%. Her repeat HbA1c turned out to be 7.9%. To improve her HbA1c, you need to add another medication. Which of the following should not be your next choice? A. Glimepiride, B. Semaglutide, C. Empagliflozin, D. Pioglitazone, E. Glargine.
Read the question carefully, Karachi. Go for it.
C. Empa.
You have time. Read the stem very carefully and consider your options.
Option C is our final answer.
Okay, option C is their final answer. Let's see if they've got it right. Lock, please. Oh no. Oh no. They tried to hit against the spin. It's looped up into the air and it's a dolly catch for mid-off. So, Karachi civil champions are in all sorts of trouble. Six questions have gone by and they've scored 12. There's still time if they have a late run to post a very competitive total, but they are under all sorts of pressure now. Karachi, you need to step it up now. You need to step it up. The stem was which of the following should not be your next choice, and the correct option was pioglitazone. Pioglitazone, which was option number D. You have to read the stem. You have to read the final lead-in very, very carefully. Very, very carefully. So, unfortunately, I think maybe you misread that. But you have to move on now. It's gone. You can't change the past. You have to look to the future now. So let's move on to question number 7.
Question number 7. Which of the following can improve her glycemic as well as cardiac profile? A. glibenclamide, B. dapagliflozin, C. sitagliptin, D. liraglutide, E. rosuvastatin.
The clock has started. Come on, civil champions. Let's see what you can do. Come on.
Our option is B, dapagliflozin.
B for dapagliflozin. Are you sure?
Yes.
Okay, let's lock in option B. Come on, Karachi. Come on. Yes! You've done it. You've done it. You have square cut the ball. It was outside off stump. You cut the ball hard. It went into the air and you went over third man for 6 runs over the boundary. You have a question?
हमारे previous question, yes, हमारे previous question में ना उसमें ना question पूरा complete नहीं आ रहा था. It was like तो उसमें लिखा हुआ था be given, not वाला option cover हो
No,
गया था.
I read it aloud, तो वो तो पढ़ के बताया इन्हें अगर पूरा ना भी नहीं रहा था. I was clear and loud.
It's okay. Let's move on.
I think we should move on. I think we should move on because the sound was quite clear. And if there's any issues, we can consult with our umpires and our technical team later on. But let's move on to the next question. You've done well answering question 7. Let's see how you do in questions 8, 9 and 10. Go for it. Question 8, please. LRH Hospital.
Question 8. She was managed by her family physician on same medication for 5 years. Recently, she started to have additional symptoms and returned to you for a follow-up. She admits that she has not been very regular about her medication. She gained 5 kg body weight and looks slightly pale. Her HB was 9.8 gram per deciliter, HbA1c 11%, serum creatinine 2.8 milligram per deciliter, and GFR of 40 ml per minute. Her current medication is sitagliptin 50 mg BD and metformin 850 mg TDS. Which of the following would be appropriate next step? A. Stop metformin immediately. B. Stop sitagliptin immediately. C. Reduce the dosage of metformin and continue sitagliptin as such. D. Reduce the dosage of both and add basal insulin. E. Continue her current medication and add basal insulin.
The clock has started.
Lactic acid is you have to stop metformin immediately. Metformin stop immediately. Stop करना.
11 का दूसरा start होता है ना.
नहीं असल में नहीं स्टॉपिंग भी नहीं है. reduce alternative stop insulin है.
11 है ना. इंसुलिन का स्टार्ट करेंगे.
लेकिन इसमें आंसर तो लिखा है continue और current medication. हम continue और current medication.
B लग रहा है. Reduce the dosage of both and add
continue और medication है. insulin metformin
20 seconds.
means you give your metformin.
जल्दी बोलो. D बोलो या A बोलो.
A.
11 का
8 seconds.
Option A.
Option A. We don't have time to ask whether they're sure. Is option A correct? Lock in option A, please. Oh no. You were discussing option D, but suddenly you changed your mind to option A. So you decided to play the ball to the offside, but change to the leg side. So that's very unfortunate. You have lost your wicket on this ball. So the pressure is on. Karachi, we have noticed that you start talking before the opposition has read your question. So can we concentrate, please, Karachi? Karachi, you must listen to the full question without talking. You must not talk when LRH are reading out their questions. This will help you as well. Let them read out their questions, listen, and then you can answer the question. It will actually help you. But at the moment, your score is 18. Don't give up. You're fighting for the honor of your hospital, civil hospital in Karachi. Don't give up. If you're going to go down, you've got to go down fighting. And if you fight, you might win. So do not lose heart. You've done okay. You haven't done great, but you can still pick up your score and make it more difficult for them to overcome you. So please focus, do your absolute best, and I know you'll be fine. Let's move on to question 9.
Question number 9. We are still discussing the same case. Her current medication is sitagliptin 50 mg daily, metformin 1 gram daily, and insulin glargine 25 units daily. Which of the following medicines can be added to improve her overall health condition? A. Glibenclamide, B. Dapagliflozin, C. Vildagliptin, D. Furosemide, E. Rosuvastatin.
The clock has started. Civil champions, you have 53 seconds. Half the time has elapsed.
Option B. Option B.
B. That's B for beta. Are you sure? Are you absolutely sure? Shall I lock it in? Okay. So I'm going to lock option B. Can we lock option B, please?
Option E.
It doesn't matter. You changed your mind, but you were right at the beginning. You were right. You said option B, then you said option E after I'd locked it. I'm not going to change it back now. You gave the correct response initially, and I think unless the umpires have anything negative, have any change of heart, I think we'll stick with what you chose initially. So option...
We should have umpire's opinion.
Okay. Thank you very much, Professor Saab. We always appreciate your input. Let's take an opinion from the umpire. I heard option B myself, but
it was B. It was the question, the dapagliflozin, because rosuvastatin, I think, because it was actually glycemic control as well as heart failure was in focus. So dapagliflozin was the correct answer.
Thank you, Professor Azizur Rahman. As always, wonderful input from you. Thank you very much.
Well, actually, the question was whether we should take their initial answer or the later answer as correct.
No, initial answer. I think we must give them the advantage.
All right.
Initial answer.
Yeah. You're gracious, sir. Thank you.
That's extremely generous of you, sir. And I'm sure that the Karachi Civil Champions will be extremely grateful that we interpreted it in that way. So wonderful input from Professor Azizur Rahman. And wonderful... So, Karachi?
Excuse me, sir. Isn't it like the initial answer was different and they later changed their answer? Isn't it like the final answer should be considered?
The umpire's decision is final. The umpire in this case has spoken, Professor Azizur Rahman. He has made his decision. That's it. It's over. The decision has been made.
Oh, okay. Thank you. Thank you.
Okay. So we accept the on-field decision of the umpire, and wherever that goes against us or for us, we have to accept it. So,
Peshawar, be generous. Be generous.
Great advice, sir. Thank you very much, as always, Professor Saab. Wonderful to have you on board as well. And let's move on. I think we have one more question. Is that right? Professor Ishaq showing how wonderfully gracious he is. As always, he's our patron-in-chief, and we're delighted to have him join us. He always advises the teams to take their time and not to jump in, not to make a mistake that allows them to be wrong-footed or deceived. And always wonderful advice and extremely generous as always. So what's the game situation?
I'm sure we can't afford to give such generous concessions in future, you see. So they should be anonymous when they're making a decision.
Wonderful. Wonderful, sir. So let's go back to the scoreboard. Civil champions have a score of 24 and there's one more question. LRH fighters, read the question and read the options.
Question number 10. According to the current guidelines, what should be this patient's primary lipid-related goal to prevent subsequent cardiovascular events? A. LDL cholesterol less than 70 milligram per deciliter. B. Total cholesterol less than 200 milligram per deciliter. C. Triglycerides less than 150 milligram per deciliter. D. Total cholesterol less than 200 and triglyceride less than 150 milligram per deciliter. E. LDL cholesterol less than 55 milligram per deciliter.
The clock has started. Karachi Civil Hospital, Karachi Civil Champions. You have 51 seconds. We are delighted to be joined on this broadcast by Professor Amir Ghafoor, wonderful professor of medicine from LRH. Great to have you on board, sir.
Cardiovascular less than 70 is the best option.
Half the time has elapsed. Civil champions, you have 26 seconds.
Our option is D. Option D.
D for Delta, is that correct?
Yes.
D for Delta. Let's lock that option in. Are they right or are they wrong? Let's find out. Lock. Oh no. Oh no. Guidelines in this situation for a high-risk patient, apparently the LDL cholesterol target should be less than 55 milligrams per deciliter. So that was very unfortunate. Karachi, you were deceived by the short ball. It flicked off your bat, hit your pad and went into the air and caught by the keeper. You are out on that ball. So you posted a total of 24. 4 correct answers and unfortunately 6 incorrect answers. Is that going to be enough? You can never tell. You can never tell in these matches. Pressure really does build. You make a few bad decisions and the pressure really builds on you, and then you're into territory. You're into the deep water. Can you swim or will you sink? Let's find out. But before we move on to the next innings, I would like to get the perspective of our patron-in-chief, Professor Muhammad Ishaq, about what he's seen so far from the teams. Professor Ishaq, are you there, sir?
Yeah, I'm there. Thank you very much for a wonderful commentary and moderation that you're doing. I feel like sitting in the Gaddafi Stadium rather than at my home and watching this match. I think pharmacotherapy of diabetes has gone through tremendous evolution, and I think this question was mostly based on the management of diabetes, which is one of the challenging jobs for any physician, whether there is a diabetologist or cardiologist or internist. Not very impressed with the score, but obviously some of the questions were a bit tricky and they found it difficult. Nevertheless, they should keep it up, and as we always say, this is a exercise of learning for both of us, for the trainees, for us, and one should not give up hope or courage if he loses. This is a game. You have it gives you a stimulus to study and improve your knowledge and expand your vocabulary about this pharmacotherapy. And I think they've done reasonably well, but they should have done a bit more better, you see. Perhaps their mutual discussion was not great, and that may have led to some of the wrong answers. But anyhow, this is a match. One has to win and the other has to lose. But I think they should not lose courage or the stamina or the motivation to learn more and more about diabetes management, which is one of the most important responsibility of the physicians working in Pakistan, at least. because every second, third person is becoming diabetic or pre-diabetic. So I think the questions set may have some ambiguity, but I think they are based on guidelines, and there are references to support the questions and the answers. Some of the answers I found a bit tricky, but then it is for the trainees and for those who fellows to learn and be up to date with guidelines. This is the era of guidelines and evidence-based medicine. There's nothing personal opinion or your own expertise. It is all based on guidelines and evidence-based medicine. So thank you very much. You've been a very good moderator. We had Hamza in the past, and you have really made a good parallel to his moderation. So you've kept the match very lively and very interesting. Thank you very much.
Thank you for your wonderful insights, Professor Ishaq. Now, our second patron-in-chief is also with us on this broadcast. Professor Javed Akram, I would love to hear your insights, sir.
Thank you. And I agree with Ishaq, whatever he said. I can't afford not to agree with him. And you are the winner as moderator. I think wonderful moderation, keep everybody on their toes, and also I think encouraging people, and really, as Ishaq said, it's like watching a test match from international ground, and the commentator, wonderful. The team, I think, the Karachi civil team, I think they know the subject, but they are unable to interpret it into action when action is required. I think they were too quick. There was no need. I think they should have delayed their strokes rather than playing it early. They were playing it too early, and also I think that the consensus wasn't there. I think the captain was just dictating and everybody was saying yes. They could have improved. And there are lessons to learn from here for them, that you have to take your time to understand the question and then understand the current scenario of guidelines, which are obviously evidence-based. As the new evidence becomes available, especially 1A head-to-head study, what we call it, randomized clinical trials, the guidelines change. So we have to keep updating ourselves, especially for the last question. And usually over the time, I've seen guidelines becoming more and more aggressive, especially for the high-risk patients. So even you have to guess, it's better to guess on the aggressive side for the current guidelines, like 2024 guidelines, and you are always better off. But anyhow, it was a very good try. It was wonderful listening to our children, and let's hope all the best of luck to them, and of course to Lady Reading Hospital team. And I think whoever wins, it doesn't matter. It's a good try, and we all learned from this experience. Thank you so much.
Thank you for your wonderful comments, sir. It's great to have such an accomplished and experienced person talking about our teams and praising them. I think civil champions, I agree, they are talented and they knew their stuff, but perhaps they didn't perform to their best ability this time. But it's a learning experience. We all get better with time and with experience, and I'm sure that the team members of Civil Champions will improve and get better day by day in their clinical practice. So now we come to the second innings. LRH fighters, let's see what they can do. So let's decide on the case, which has already been decided. Can we have the case up on the board? And can we have Karachi Civil Champions reading out the case scenario for LRH fighters, please? Karachi civil champions. Can you read that scenario, please? And I hope LRH can see that.
Case P. While working in a tertiary care hospital, you were consulted by your colleague, gynecologist, who was worried about high BP in her young patient. According to her, a 30-year-old unmarried female presented to her with chief complaints of weight gain for 1 year and frequently missed menstruation periods for the last 8 months. Her menarche started at the age of 12 and it was regular to the start of these symptoms. She denies any history of dry skin, dry hairs, generalized fatigue, or constipation. She was obese with BMI of 31 kg per meter square with facial acne and facial hair growth, but no facial or hand deformity. Her BP was 140 by 90 millimeter of mercury, pulse 92 beats per minute, and BSR of 143 milligrams per deciliter. Her past medical history was insignificant, but her father was a hypertensive patient since his 39 years age. She likes to eat junk food with no physical activities.
That's case scenario B. Lady Reading Hospital. Did you hear that? Did you read that?
Yes.
Okay. So now you are ready for the questions. Are you ready, Lady Reading? Are you ready?
Yes.
Great. Let's get the show on the road. Let's go for question number 1. Civil champions, read out the stem and read out the options.
Question number 1 is, what will be your first advice to your colleague gynecologist to proceed with this case? A. Consult a nutritionist to control her weight. B. Start anti-obesity treatment. C. Consult a dermatologist for her acne and hirsutism. D. Do a transvaginal ultrasound. E. Follow up after 1 month, heavy exercise.
The clock is ticking. You have 1 minute to answer this question. Let's see if you can get a good start to this innings. Can we have Lady Reading Hospital fighters on the screen, please? Leave your mics on, please. Everybody, both teams.
We'll go with option D. D for dog.
D for dog. Do a transvaginal ultrasound. You've got 18 seconds. Fighters, are you sure? Is that the decision of all of you?
Yes.
Okay, I'm going to lock it. Option D, please. Let's lock it. Can they do it? No! Once again,
My humble suggestion to the team is that they should consume the full 60 seconds. They should not rush on the answer. They may still come with the wrong answer, but I think they should consume their time.
That's
my humble advice.
Extremely good advice by Professor Ishaq. He's been there, he's seen it. He's seen this competition since the very beginning. And I would endorse that as well. So the answer was A, consult a nutritionist to control her weight. So you played outside off stump and you were caught at slip. So the pressure is on. Pressure can build. Let's see how you can handle it. Let's move on to the second question.
Question number 2. What will be the next most important clinical step to reach the diagnosis? Option A, check BP again. Option B, take her history again. Option C, perform precordial examination. Option D, check waist circumference. Option E, check weight gain.
The clock has started. I can't hear you, Lady Reading. Keep your mics on, please.
It's on.
Okay, good.
40
seconds.
To reach the diagnosis. No. Take her perform precordial.
30 seconds left.
Check BP. History world. Take history again. Huh? Take history. Huh? Come here.
3 seconds.
A. Option A.
It has to be option A. No second chances. Can we lock in option A, please? Oh no! You faced a slower ball. You faced it with a straight bat, but it dollied up in the air. It was caught by the bowler. You are caught and bowled. So you are under pressure now. You faced 2 deliveries and you've got out twice. So the score is 0. You're still in this match though. You can still win. You can still win. The opposition score is 24. You can still win. You used all the time this time. Unfortunately, you were unlucky this time. But don't give up. Don't give up. You can still win this match. So Lady Redding, let's move on to question number 3.
Which relevant lab test would you like to order first to establish your diagnosis? Option A, ECG. Option B, lipid profile. Option C, renal function test. Option D, serum electrolytes. Option E, echocardiography.
The countdown has begun. $30 left. $20. Come on, fighters. Take your time.
Option B.
B
for beta.
B for beta. Is that a lock? Is that a lock? Yes, it's a lock. Lock it in, please.
Yes.
Oh, yes. Yes. Lady Redding Hospital fighters are off and running. Off and running. You faced the ball down the leg side. You flicked it, but it's gone in the air and it's gone over square leg. They tried to catch you out, but they missed because it went well over the boundary and into the stands. So you have scored a 6 on your 3rd time of asking. So the score is 6. You've done very well. You took your time. You didn't dive in. You did a good job. Well done, Lady Redding Hospital. You're chasing down that title. You're still in the hunt. You have 7 questions left, and you need to beat the score of 24. So let's move on to question number 4.
Question number 4 is, all of the following are the criteria of the suspected disease except option A, LDL greater than 150, option B, abdominal obesity, option C, triglyceride more than 150 milligrams per deciliter, option D is HDL less than 50 milligrams per deciliter, option E, hypertension.
The clock has started. You have 1 minute, Lady Redding Hospital fighters. Can we go on to Lady Redding? Lady Redding, can you hear me?
Yes, yes.
Okay, great. $30 left, Lady Redding.
Hour.
15 seconds, Lady Redding fighters. Three
D
seconds.
for dog. Option
D for dog.
HDL less
D. HDL less than 50. Desperate in the last second. Did Lady Redding get through? Did they do it? Lock in option D. Oh no. Oh no, they faced an in-swinging Yorker and it has battered their leg stump. It flies in the air and then impales itself into the ground. They are out of this question. So the correct answer was the one criteria that was not in the diagnosis of this suspected disease was the LDL. All of the other criteria fulfilled the diagnostic criteria. So where are we at now? In this low-scoring match, civil champions have scored 24, and so far Lady Reading Hospital fighters have scored just 6. So whatever it is, it's a very tight, close and low-scoring match. And the pressure is always on in these types of contests. Can Lady Reading Hospital get back in the fight? Can they live up to their name as fighters? Or will they fall at this stage? Let's find out. Let's move on to question number 5.
Question number 5 is, after receiving her lab reports, she likes to know the exact cause of her symptoms. What is the diagnosis? Option A is Cushing syndrome. Option B, metabolic syndrome. Option C, hypothyroidism. Option D, hyperthyroidism. Option E, Lawrence-Moon-Biddle syndrome.
The countdown has begun. The pressure is on. Can Lady Reading Hospital fighters reduce the pressure? Can we have Lady Reading Hospital fighters on the screen, please? "30 seconds left. Fighters."
Option
seconds.
B. B for ball.
B for ball. Are you sure, gentlemen?
Yes.
Okay, they are sure. That's a lock. Option B, metabolic syndrome. Are they right? Are they right? Are they right? Yes, they're right. Yes, they are right. They have gone down the track to the spinner and smashed it over long off. It's into the stands. It's caught by one of the spectators. They have hit a 6. Well done. Well done. Very well done. You used the time, you consulted, you made sure. So you are back in the game. You have 5 questions left, and you need to score 12 more runs to tie, and you need to score more than 12 to win this match. You are back in the game. Well done, Lady Reading Hospital fighters. Keep it up. Let's move on to question number 6.
Question number 6 is, to prevent the cardiovascular risk in her disease, what is the most important single advice to her? Option A, use of statins. Option B, follow-up visits. Option C, weight loss. Option D, use of ACE inhibitor. Option E is use of beta blockers.
Countdown has begun. Can Lady Reading Hospital fighters turn up the heat? Or will they freeze up? Let's see.
Option C, weight loss.
That was very quick. Very, very quick. Very aggressive. Are you sure? 30 seconds left. Are you sure? Is that the opinion of all of you? You have to be sure. "20 seconds. Fighters."
C, confirm.
Okay,
C
let's
for
lock it
cat.
in. Let's lock it in. C for cat. Is it weight loss? Is it weight loss? And again, another 6. Another 6. They have pulled it over long on, and it's gone over the boundary, and it's 6 runs. So brilliant. Brilliant, brilliant play. Relieving the pressure, and now they are in the driver's seat. Now they are in a position where they can win it. It's close. 4 questions left. They need to score 2 to win and 1 to tie. So Lady Reading Hospital are in the box seat now, and they are building up momentum, and they are relieving the pressure in this extremely tight contest. So well done to them. Let's move on to the next question. Let's see if they can tie the score in this question. Question number 7, please. Karachi Civil Champions.
Question number 7. Considering her age, what is the most suitable antihypertensive drug to be started? A. ACE inhibitors. B. Beta blocker. C. Calcium channel blocker. D. Diuretics. E. Combination therapy.
Your time has started. Lady Reading Hospital on the screen, please. Half the time has elapsed, 30 seconds left. Fifteen seconds. 10 seconds.
Option A.
Option A, ACE inhibitors. Let's lock that option. Yes, again. A hat-trick of sixes. A hat-trick of sixes. A cover drive which has gone in the air and it's gone over the fielder who's on the boundary. He can't catch it because it's gone well over his hands and it's gone into the stands for 6. So another shot, another brilliant play by Lady Reading Hospital, and they have tied the score. They cannot lose this one. They cannot lose. They can only win or draw. So let's see if Lady Reading can win this match. 3 questions left. Question number 8, please.
Question number 8 is, she was put on an ACE inhibitor, statin and low-dose metformin with proper exercise and weight loss techniques by you. But 6 months later, she started complain of muscle weakness and pain, especially of the thigh and shoulder region. She lost weight and her BMI is now 28 kg per meter square. What is the possible cause of her symptoms? A. Weight loss. B. ACE inhibitors. C. Metformin. D. Strenuous exercise. Or E. Statins.
The clock has started. You have 1 minute. If you answer this question correctly, you will have won this contest, Lady Reading Hospital. 40 seconds.
Muscle weakness, especially pain and shoulder region.
30 seconds.
We'll go with option E. E for egg.
E for egg. You have 20 seconds left. Are you all sure about that?
Sure, yes.
It's a big decision. It's a big decision. Can you win the match? 10 seconds. Last.
Yes, yes. Option E.
Option E for statins. Can they win it? Can they win it? They've done it. They have won the match. They have won this contest. They are the winners of this match. They have played very boldly and very calculated, and they have overtaken the score of Karachi Civil Champions. They cannot draw now. They cannot lose. They have won this match, but now they need to score as high as possible because they are in Group B, and only the group winners, the ones with the highest scores, will get through. So 1 team out of 6. So you've defeated Karachi Civil Champions, but you also need to score higher than the 4 teams that are left in this group. So you need to continue being focused and score as high as possible. So, Lady Reading Hospital, keep your focus. Try and get the next 2 questions right. Let's move on to question number 9.
Question number 9. 1 year later, she visited you again with the complaints of persistent dry cough. Her throat and chest were clear. She was compliant with the prescribed treatment. Her BP was recorded as 120/80 this time. What will your advice be to her? A. Decrease dose of ACE inhibitors.
No talking.
B. Switch ACE inhibitors to ARB.
Only
C,
the questioner must speak.
Start antihistamine. D. Start nebulization. E. Start antibiotics.
Okay. So, the timer has begun. Lady Reading Hospital, fighters. You have 5 options. Let's see if you can increase your score.
B for ball. Switch ACE inhibitor to ARB.
Okay, that was a very rapid response. Are you sure about that? You have time to think about it?
Yes, absolutely.
So they
Option
are
B.
absolutely sure. Option B, B for beta. Switch ACE inhibitor to ARB, a decisive option. Are they right? Wonderful, wonderful play. That's another amazing, amazing shot. They have scored 5 in a row. They have played a reverse sweep. The reverse sweep has gone over the third man boundary for 6 runs. So a creative stroke, but with the desired outcome of increasing the score. They have a competitive score. They have 36 with 1 to play. Let's see if they can improve that even further and get an even better score. Let's move on to the final question, the final play. Question number 10. Let's see what Lady Reading fighters have got. Question 10, please. Read it out, please. Karachi Civil Champions. Do we have Karachi Civil Champions technical team? Karachi Civil Champions, can you hear me? Can you read out the question, please?
I cannot see the question.
Okay, in the interests of time, I shall read out the question. Lady Reading, can you see the question?
No.
Lady Reading, can you see the question?
Yes, yes.
Okay, no
We can see
talking.
it.
I'm
Can
going
you-
to read the question out and give you the options. Question 10. She was concerned about her deranged liver function test 2. Her ALT was 98 units per litre. AST was 49 units per litre. Bilirubin was 1 milligram per deciliter with normal albumin and clotting profile. Ultrasound abdomen showed stage 2 fatty liver with no signs of portal hypertension. What will your advice be to her? Option A, reassure and continue with weight loss plan. Do not talk while I'm reading the options, please. Option B, perform viral hepatitis profile. Option C, test for serum alpha fetoprotein levels. Option D, have CT abdomen with contrast. Option E, start antiviral treatment. The clock starts now. Now you may discuss. Crucial question to get right, to build a competitive score. Half your time has elapsed. You have 27 seconds.
Option A.
Option A for alpha. Will you be the
Yes.
alphas of this competition? I wonder. 17 seconds.
Yes.
Are you sure?
Yes, sure.
Okay, they are sure. So option A, reassure and continue with weight loss plan. Please lock that in. Yes, yes, yes. Brilliant, brilliant stroke play. Brilliant. They have gone down the pitch and smashed it. Smashed it well over the bowler's head, over the long on fielder. It's out of the stadium. It's out of the park. They have scored 6 sixes in a row. They have devastated the bowler. Devastation. And they have completely and utterly dominated this particular contest. Let's see if they can get through this group. Brilliant performance by Lady Reading Hospital fighters. They didn't do well in the first 2 questions, but they kept their composure and they are possibly through to the next round. We'll have to see what the next 2 matches discloses. So, I would like to initially get the comments of the winning team, and then we'll go on to our senior professors. What was your feedback, Lady Redding?
It was an extraordinary experience. Initially, it was a little disappointing on our part because we were too hasty in giving the answers, but later on we did a very good job, I believe. Thank you for giving us this opportunity.
I'm sure that your colleagues at LRH are very proud of you. And if you manage to get through to the next round, I wish you good luck because you've been a wonderful team. I would like Karachi civil champions as well. I'd like to know what your feedback is based on this competition that you've entered. Karachi, please. Can we have Karachi?
Giving us support. Thank you for giving us the opportunity. It was a learning experience for all of us. Thank you very much.
I think you performed well, and I think it was just unlucky. And hopefully it's a learning experience for you guys, for both teams. And I'm sure you're going to come back bigger and better next time. Wish you all the best, Karachi. Now, can we have our patron-in-chief, Professor Muhammad Ishaq, for his comments based on the contest?
Thank you very much. What a match, what a performance by LRH, my old alma mater. I can see Professor Amir Ghafoor in a jubilant mood. I think they played very well. At the same time, they were quite lucky that the questions which were drafted in their scenario slightly easier than the previous scenario, and the questions were a bit easy because I could answer all of them. So I think if we can answer, they're really easy questions. So, but anyhow, very well done. And as you say, you see, one has to lose, the other has to win. But it's a mutual learning. It's a comradeship, and nobody should take it to the heart that they have lost it. They haven't lost anything. They will learn from their mistakes. It will be act as a stimulus to read more and expand their knowledge. And wonderful moderation by yourself. You have kept everything so alive and lively. That's the way to proceed. And I think once again, congratulations to the winning team. And LRH has been my alma mater. I was trained there as a junior doctor. And I think because there's not much to do in Peshawar and other parts of KPK, people spend more time with their books and learning. And that's why each time we have any competition or examination, our boys from KP
Professor Amir
do
Ghafoor.
better.
सर इसाक साहब आप वापस आ जाए हमारे पास, हम होशियार लोग हैं पठान, और फिर नस्वार भी डालते हैं तो डबल होशियारी हम में.
Professor Amir
ये तो
Ghafoor
पता नहीं कि
is
आज इन्होंने नस्वार डाली थी कि नहीं, लेकिन I think with नस्वार they can perform much better.
Professor,
I'm sure.
Professor Amir Ghafoor, just to introduce, Professor Amir Ghafoor is a professor of medicine at Lady Redding Hospital. That's why he has such a wide smile on his face. Congratulations, sir. Wonderful performance by your team, especially on the last 6 questions. They just blew the opposition away, and they were very, very relaxed and they were very confident. And that's a testament to the mentorship and the training at LRH. So well done to you, sir.
Thank you for your kind words. And I think the kids did, the Karachi folks were also very good.
Yes.
But you know, the whole exercise is how to perform under stress. And I think the knowledge of both teams are almost the same. Thank you.
Thank you, sir. And at this time, it's worth emphasizing that both of these teams are very junior doctors and they are at a very early stage of their training. And so this is a wonderful opportunity to kind of pit their wits against other teams and also increase their knowledge and also encourage them to go further with their readings. So I think it's a very good performance by both teams. I think Karachi civil champions were extremely unlucky with some of the questions, and I think they probably didn't process the STEM properly in one or two cases. But once again, Lady Redding. Now, Professor Javed Akram, I would like your thoughts as well before we close up.
Thank you so much. I think a wonderful match. And we all learned from this match, including myself. It's always a pleasure to see our kids competing on the academic arena, and especially with you moderating. You make it very, very interesting and engaging to all of us. And better luck, best time. I think, as we all said, they need to prepare, they need to take it more seriously, and they need to be composed. It's okay. I mean, win or lose, it doesn't matter. But the losers must motivate them to learn more and educate themselves more. And art of medicine. Our true war is not this. Our true war is when we are fighting for somebody's life by the bedside. And I hope we all win that time, because that's somebody's life. But it's very good to rehearse like this. There also we are a team. One is somebody's captain, somebody is insisting CPR, some nurse is giving us drugs and whatever. So this is a very good way of displaying and rehearsing the team spirit. And unfortunately, sometimes we lose because the ultimate decision maker is Almighty Allah. But doesn't matter, even if you lose, you must lose with dignity, and you must lose to learn and win next time. Thank you so much.
Thank you for your wonderful comments, sir. I would like to bring on Professor Azizur Rahman, who was an umpire in this match today, for his comments. Professor Azizur Rahman, please.
Thank you very much. I think congratulations to the winning team. And I actually finalized these questions, and I think it is always very difficult to keep them both a case scenario at the same difficulty level. I think Professor Ishaq's observation is right. The first scenario is a little difficult. The second one was easy, but the team actually could not figure out the diagnosis of metabolic syndrome until they were asked a question number 5. Once they did that, and then everything was easy for them. So I think, as everybody said, it is actually everybody who participate in these contests, they are winners. Those who do not participate, they are the losers. Thank you.
Wonderful advice, sir. Wonderful comments. And last but definitely not least, Professor Kashif Ali Hashmi. Sir, I'd like your comments on this contest as well, if you're there, sir.
Say a very, very informative section. Both team done their best, and definitely one has to win and one has to lose. But it was an interesting contest, and I think all of us learned from it.
Thank you for your wonderful comments, sir. Thank you. I'm sure both teams will appreciate it. So there we have it. Match 4 is over. LRH fighters have been triumphant over Karachi civil champions. They have a chance of getting through from this Group B. We will have to see in the next 2 matches if anyone can surpass their score of 42. So that's an end to this contest. Thank you very much to Wilson's Pharmaceuticals, who have been instrumental in bringing this forward, and for the support of the Pakistan Hypertension League and the Pakistan Society of Internal Medicine. That is it. LRH are through. The fighters have defeated the champions. We'll have to see who wins match 5. But from me, thank you very much for joining this broadcast. Allah Hafiz.